When you stop and think about it, a simple visit to the pharmacy can tell you a lot. Sometimes it's nothing more than a quick stop, but other times, that one visit can show you all the cracks in a healthcare system. Today, we're diving into how technology is building a bridge over those cracks, connecting what might be the most crucial and often the most isolated part of care. This quote right here, it just gets to the heart of the matter, doesn't it? For millions and millions of people, healthcare doesn't start in some shiny hospital or a fancy specialist's office. Nope, it starts right at the counter of their local pharmacy. It is by far the most accessible front door to the entire system.
And to really understand why this is such a big deal, let's walk through a story that lays out the problem perfectly. It's a story that, unfortunately, plays out in countless communities every single day.
Okay, so it all begins with a symptom that just will not go away. 6 weeks. Just try to imagine that for a second. A persistent, nagging cough for 6 straight weeks. That's way more than just an annoyance. It's a clear sign that something is seriously wrong.
So what does he do? Exactly what most of us would do. He goes to that front door of healthcare, the pharmacy. And not just once. He goes 3 separate times, really hoping for a solution, for just a little bit of relief.
And every single time he goes, the response is the same. Here's some cough syrup. Now, that's a logical first step for the symptom, sure, but it's not getting anywhere near the root cause. So the cycle just continues. He's seeking help, but not actually getting better.
And this is where the story takes a really serious turn. Much later, the real diagnosis finally comes in: tuberculosis, a dangerous, contagious disease that was just left untreated for weeks, all because the system couldn't connect the dots.
So your first instinct here might be to ask, well, was this the pharmacist's fault? Did they miss something obvious? And look, that's a fair question, but it's really looking at the problem from completely the wrong angle.
The answer is a clear and simple no. This was not an individual failure, it was a total system failure. The pharmacist was doing their job with the limited information they had. The real problem was the broken system they were forced to work in.
So this brings us to the real heart of the issue, understanding this systemic gap. We have to look at why that front line, the pharmacy, is so often completely disconnected from the rest of the healthcare world.
This contrast here really says it all. On the one hand, you've got the incredible promise of telemedicine. It can give people access to primary care, help manage chronic diseases, connect them with specialists. We've seen some amazing pilots in places like Rwanda, Nigeria, and Kenya. But on the other hand, the reality on the ground is just fragmentation. Referrals get lost in the ether, patient history vanishes between visits, and those specialists in the big cities feel a world away from patients in rural areas.
Let's just break that fragmentation down a little more. The software a pharmacy uses doesn't talk to the software a hospital uses. So, when a patient moves between them, their history doesn't follow. It's like hitting the reset button and starting from scratch every single time. A pharmacist might recommend seeing a doctor, but that referral often just breaks down. There's no follow-up, no shared info. It's a dead end.
And this really gets to the core of it all. The problem isn't a lack of technology. We have so many of the pieces already. The thing that's missing is the connection, that digital thread that can finally tie all these isolated points of care together into one cohesive whole. All right, so this is where the story turns a corner, shifting from the problem to a real solution. A company called AfriPharm Health is building a brand new model, one that transforms a simple pharmacy partner network, or PPN, into a fully integrated healthcare network, or HCN.
It all starts exactly where the patient is, the local pharmacy. So AfriPharm Health builds this network of partner pharmacies, and they empower them with the tools they need to become that first, vital link in the chain.
So when a pharmacist spots a red flag, like that persistent cough we talked about, they can use the system to immediately trigger a connection to a virtual care network. The patient doesn't have to go anywhere. The specialist comes to them, digitally, right then and there.
And that virtual network? It's completely connected to a hospital partner network. What this means is, if the virtual doctor decides the patient needs to be seen in person or needs some tests run, that referral is absolutely seamless. The data, the history, the diagnosis, it all flows together, unbroken.
So what does this actually look like in practice? It's really simple. Step 1, a pharmacist flags a concern in the system. Step 2, right there at the pharmacy counter, the patient starts a virtual consultation. Step 3, the doctor on the other end gets instant access to the patient's entire history and their health vault, a secure, single digital record. And then, Step 4, the diagnosis, the referral, a prescription, it all happens in real time. No more delays, no more lost information.
Now, this isn't just a cool idea on a whiteboard. Let's look at 4 real-world scenarios where this connected approach is already making a life-saving difference all across the continent.
Just take a look at these examples. In Southern Africa, you've got that persistent cough again. But this time, it's quickly flagged, a virtual consult confirms TB, and an immediate referral helps stop community spread. In West Africa, a pharmacist is concerned about blood pressure readings, which triggers a virtual consult that prevents a stroke. In East Africa, a child's fever is correctly diagnosed through the malaria pathway, and that same-day action can literally save their life. And for a diabetes patient on the edge of a city, a remote consultation from their pharmacy totally changes their long-term health. The impact here is real, and it's immediate.
And this, right here, is probably the most important thing to get. This solution isn't about replacing the pharmacy or making it obsolete. It's about finally recognizing it as the most accessible and trusted place in the healthcare system, and then strengthening it, giving pharmacists the power to be the starting point for truly comprehensive care.
So what this whole system really achieves is this fundamental shift. It's transforming the simple pharmacy counter from just a place you pick something up into a gateway for a real, meaningful medical consultation. It completely closes that gap we were talking about. It creates this unbroken digital line that leads a patient directly from their very first symptom to the exact specialist they need to see, no matter how far away they are. And ultimately, it takes what used to be this isolated touchpoint, a lonely outpost on the healthcare journey, and weaves it into a fully connected, responsive, and intelligent system that works for everyone.
So I'll leave you with this question to chew on. What happens when healthcare's most accessible door, that local pharmacy on the corner, also becomes its most powerful and connected one? The potential to change millions of lives is just staggering.